Hi, everyone. I'm Victoria Valdez, the owner and operational director of Tri Synergy Counseling that is located in Brentwood, Tennessee. And thank you so much for signing up for this webinar because I'm super excited about telling you guys about what intensives are and how powerful form of healing that you can get for unresolved childhood trauma. So I'm going to talk a little bit in this webinar about what trauma is, what unresolved trauma can look like, and then what in counseling intensives are, what modalities that we use in Tri-Synergy counseling, and what it would look like a day of, or a day in the life or the day of a session in counseling intensives. And remember, this is all educational. This is not a diagnostic tool, any of the information. And also, I'm not doing a deep dive into trauma or childhood trauma or unresolved trauma. It's just an overview. And if you like what you're hearing and you live in the state of Tennessee and you want to try an intensive, you can reach out to us by Googling our website, www.trisynergycounseling. And that's tri-synergycounseling.com. And then you can check it out there and figure out when you'd like to book one and give it a try. You also can see our events of little smaller intensives that we do. So that being said, let's get started. A little bit about me is that I'm a licensed marriage and family therapist who specializes in treating children, teens, and adult women in the state of Tennessee. I'm also a parent coach and a wellness educator and lens neurofeedback provider technician. I am Spanish speaking, and I am the Tennessee State Spanish speaking therapist group leader. I'm a mom myself of 3, and I am also a trauma survivor. And so I've done my own work, which is why I'm passionate about helping others with theirs. On my free time, when I'm being a business owner, doing mental health things, I love spending time with my family and kids. And I also love Latin dancing. Salsa, merengue, cumbia, bachata. I used to teach it before I was a therapist. But that being said, let's get into the meat of and unresolved childhood and trauma and counseling intensives. This slide is a little bit more about Tri-Synergy counseling, which is important. But I want to get into the time of talking about the meat of the presentation. So we're a group private practice located in Brentwood. You can learn more about us. We have several clinicians, Spanish-speaking staff, and so we are here to help and support you and your family. So you can check us out. All right, trauma. So trauma is the long-lasting emotional distress response that comes from the experience of living through a distressing event, a very scary event, horrific event, right? And this exposure or experience, a traumatic event, can really affect a person, a child, a person's sense of their safety, sense of their self and who they are, their confidence, their ability to regulate their emotions, and their ability to navigate and have healthy relationships and attachments, and so much more. We know that it really affects people's physical health as well. And this happens even long after the traumatic event has happened. People with trauma can have a sense of deep shame, helplessness, powerlessness, intense fear, other mental health conditions, anxiety, depression, executive functioning, processing issues. There's so much things and symptoms of experiencing trauma. And in these 4 pictures, it can be a war. It could be experiencing violence, natural disasters, bullying. And I'm going to dive into a little bit of more things from trauma. So sometimes when I hear people recanting their trauma story, a lot of times it's like I can remember it like it was yesterday. And everyone has their own trauma story, and it's all different, and everyone experiences it differently. And let me just also add that a lot of times people will say, well, I don't understand. My sibling and I experienced the same, witnessing the same domestic violence trauma, but I don't feel the way that my sibling is affected. It doesn't bother me as much. And my answer to that question, I get this question a lot from people, clients, or from family members or other people. First of all, people's physiological response, their neurodevelopment is different and unique to each. Yep, the new research says there are some brains that are built more resilient than others. On top of that, it also depends on people's support systems, what kind of treatment and support and healing that they got as they journeyed, um, what kind of people were involved in their life to build that bridge of any attachment wound or things like that. And if people are more isolated and came from a background where there wasn't a lot of support, then they're going to be more susceptible to trauma symptoms and having it affect them in a more negative way. So it really depends from person to person. But so what we know is trauma has no boundaries regarding age, gender, socioeconomic status, race, ethnicity, or sexual orientation. Trauma is a common experience for adults and children in American communities and across the world. There's a lot of trauma. And it is especially common with the people's lives who are experiencing mental health and substance use issues. If you think of post traumatic stress disorder, one of the symptoms is flashbacks, but also anxiety, depression, being able to process things, a constant vigilance of looking over your shoulder, not being able to manage your emotions. And so a lot of times we get diagnosed with anxiety and then no one realizes, well, it's from a big trauma that happened that you may not have ever considered it being a traumatic event. Or I'm going to talk about Dr. Bessel a lot, one of the lead researchers in the United States, just a psychiatric doctor, just amazing, led research on he has a book out there called The Body Keeps the Score. He wrote it for general public. So I love it. It's a powerful book. Even if you're not a therapist or in the helping field, reading that book is really powerful. So I'm going to talk about him a lot, but he talks a lot about trauma's not, there's no respecter of persons. It affects everyone differently. So really, really powerful. So this is an umbrella, right, of trauma experiences. There's definitely more than these, but you'll see these. Lost where they never, you know, no one ever found the body of the death of someone, things like that that can be really challenging. So definitely some of the list of traumas there. If you have joined us in this live webinar, please be advised that it is being recorded. So you want to turn off your cameras. But more other trauma examples can be physical and sexual assault, neglect in the forms of medical, educational, emotional, and there's more forms of neglect, whether it was intentional or not. Serious accidents or life-threatening illnesses, racism and discrimination, generational trauma, right? So there's a lot of different traumas that we experience. So because this webinar is talking about childhood trauma or unresolved childhood trauma, I'm going to give a very general overview of that. So experiencing abuse or neglect as a child can have a really significant impact and be felt across several areas of an individual's life, such as emotional health, physical health, mental health, personal relationships, and so much more. So, when we talk about full body wellness, mind, body, soul, or spirit, having a childhood traumatic event really affects all of those areas. So when we think of childhood trauma, it's generally a broad term that is associated or relates to trauma experience in the early childhood years, developmental years, early developmental. And then childhood trauma tends to have the most significant adverse psychological consequences. And to that, specifically childhood abuse and neglect. Now, not all trauma results from abuse and neglect, right? We talked about all the different ones, but it's most commonly reported by survivors that through their adulthood that it's something that still affects them. And we know that these experiences from childhood often lead to poor self esteem, difficulty forming healthy relationship attachment, and so much more. Since I work with adult women and children and teens, I see this come full circle where they had a childhood traumatic event or a series of, an attachment wound. And now they're teenagers. And yes, as teenagers, we definitely have issues, where our self esteem is not always the best. We're trying things out. But you really see those teens with the childhood abuse really struggle with having healthy attachments. It's hard for them to set boundaries. They're even more so looking for acceptance and love because they're missing that component from early childhood. And then you see that full circle when they're adults and they weren't treated for their trauma experience as a child or as a teenager, and now they're adults, and now they're having if they haven't already, having physical symptoms and fear of commitment in relationships, fear that someone's going to hurt them, that no one will ever love them because their parent or guardian didn't love them the way that they wanted or needed to be loved developmentally, to have that strong confidence. So there's a lot there. I see it all the way up to the top. And so what a lot of clinicians call this is the trauma from earlyhood development as a child is an attachment trauma wound. And it's the result of the actions of caregivers or the lack of action for a child during those developmental years when the attachment is formed. I like to use the example of a baby that, for whatever reason, was not able to give that child the attention and love did that baby need it. And so maybe the baby wasn't picked up very often when it was cried and cried and cried. And so now it's developed that inborn nature of, I don't feel safe in my own body, or I don't feel like there will be anyone there to hold me or care for me because they were in distress for so long, over and over and over again. And so that is formed right there. I like to give that as an example. Or the child that unfortunately grew up in foster care, many disruptors where there was child abuse, and they're in foster care, bouncing home to home. It's really difficult for them to form attachments and learn that they are valued and loved just for who they are. And then you see them become teenagers, and then you see them become adults, and they're really struggling. So different examples there. Okay. So a little bit more about unresolved childhood trauma. So typically an attachment wound this is not like every wound symptom, but some common ones: it's low self-esteem, rejection sensitivity, that if maybe someone told them they couldn't hang out today and immediately, I'm worthless, I'm not worthy of hanging out, I'm not lovable, instead of, oh, they were just probably busy. Lots of negative self-talk, really more of that approach of the glass is half empty, or there's nothing good that's ever happened to me. My life is always sucky. Something bad is always going to happen. There's no hope, right? Difficulty regulating their emotions. That ability, you might see them snap off right away. It's hard for them to maybe calm themselves down, or they, like I said, snap to right away. Difficulty setting boundaries can be really hard for those with childhood trauma or unresolved trauma, because there's either no boundaries whatsoever, there's lots of guilt, I don't feel worthy of putting that line, or they were constantly forced in positions where there were no boundaries set, abused, right? Or too hard boundaries. I won't let anyone in because I don't want to be hurt because no one was there for me. Difficulty expressing emotions, and there's just so much more. But there is hope and relief. This is where I introduce the concept of counseling intensives. So a counseling intensive is basically, it's 3 to 6 months, if you can imagine, 3 to 6, sometimes more. But imagine 3 to 6 months of therapy sessions condensed into a 1 to 7 day period in 1 week, to 8 hours each day. specifically tailored to deal with that childhood unresolved trauma. We're not working on anything else but that. Very acute, intentional time on those things. So there's been a multitude of studies, but I really liked this one by Ehlers from 2014. I'm probably mispronouncing that last name, but it was a very large, well-designed, it was a random study. And what they did is that they provided evidence-based post-traumatic stress disorder trauma treatment in a 1-week course of time, in 1 week. And then they also provided that very same type of treatment with other individuals, group of people, just weekly sessions over a several months period. And what they found, but the results were both the same. So there was an significant improvement on the people who received specialized trauma treatment and had weekly sessions, and the same results for those who did it in 1 week. But what they found is the people who spent 1 week working on that trauma moved much more quickly and then achieved higher, faster rate of healing and more quickly through their trauma in that intensive 1 week format than those who spent several months, 3 to 6 months in therapy. Very powerful. So intensives, adding to that study, is that intensives can be really cost effective. And the reason why being is because individuals, when you pay for an intensive, you're paying for a day or that 7-day period, whatever you're paying for. You're paying for that chunk of time rather than paying for the weekly sessions 6 months to a year long. So imagine paying maybe $2,000 to $5,000 upfront, which sounds like a lot, depending on how many days you get, what your services you're getting. Imagine paying that $2,000 to $5,000 up front and doing, 5 to 7 days of an intensive versus going to weekly sessions for about 45 minutes for 52 weeks. That's how many weeks are in a year. So imagine about $200 therapy. High quality therapy can be costly, right? So imagine $200 times 52 weeks. That's over $10,000. Imagine paying half of that in 1 week's time. So, and getting that fast results and not going to a year's worth of sessions, right? So that's cost efficient. And the other thing is it's a time saver. So imagine being able to not have to drive to your therapist's office and then drive back. That, who knows what that turnaround could be like depending on how far you're driving. It really depends, right? So imagine being able to just not have that down and back. I know for me, I have clients who will drive to see me from an hour away or 30 minutes away, right? So that you can see how that can turn into like a 3-hour trip. So now maybe many of you can say, well, I see my therapist virtually, right? But imagine what you could do with that 1 hour of your time that you're not seeing the therapist virtually, because you don't have to see them for 6 months to a year, 1 hour a week, because you did that 1 week intensive or you did those 2 or 3 day intensives. Pretty powerful. And then the other thing that's really beneficial about counseling intensives is it's fast. As that research, randomized research did, much more quickly achieve the treatment goals, reduction of symptoms much more quickly. Yes, healing is not a race. Sometimes I wish I had a magic wand. I tell my clients, I wish I could magic wand you and poof, you felt so much better yesterday. You don't have any more anxiety. You're not feeling depressed. And you know that you are the best person. You are amazing despite what happened to you. Like, poof, I wish I could do that. But I can't. But what I can do is offer you or your loved one a 1 week intensive or 2 or 3 day intensive and accelerate that healing versus years of therapy or 6 months to 12 months of therapy. So again, healing is not a race, but imagine if you could feel better faster. Who doesn't want that? So what if you could sleep better, have less anxiety, less trauma triggers, less flashbacks or no flashbacks, less depression, improved confidence, and just improved relationships. You're in a better mood. I mean, just improved everything within a week's time. What if you could experience that as soon as within a week's time versus waiting 6 months to a year or 2 years to feel better? Something to think about. Interventions. So you can Google intensives across the country or locally. Everyone's got all sorts of different modalities. So I'm just going to focus on what we offer here at Trice Energy Counseling. Part of your intensive package, whether it's one day or if it's over several days, include lens neurofeedback, which is the picture the gentleman has wires connected. That's the lens neurofeedback. Brain spotting, that picture with the little gummy bear on a wand. Sand tray therapy, forms of meditation and a little bit of polyvagal, emotional freedom tapping, therapeutic journaling, rather I should say therapeutic expressive arts. Now, let me go back there. I'm not going to deep dive into each one of these modalities, but you can visit my website at tricenergycounselingtn.com, and there's some blogs or different deeper explanations that go into these different modalities and what they are and different demos. I've also, if you visit my YouTube channel, you can access it through my website. I have very, 45-minute to 50-minute extensive live webinars on lens neurofeedback. Stay tuned for more coming up soon about deep dives into brain spotting and sand tray and these different modalities, so you can have a good picture, sense of like what you're going to be experiencing in an intensive. But I am going to highlight a couple here. So neurofeedback. In that picture, there's a picture of a baby, a toddler getting neurofeedback as a model. Yep, lens neurofeedback can be done as young as newborns for any birth trauma they experienced. So neurofeedback makes use of the brain's capacity for change to reshape brain networks and neuroconnection, to improve neuroconnection, and to actually help the growth of neuroconnections. It is a way to train the brain to function better, directly, and more efficiently. Neurofeedback is a research support treatment to manage arousal, sharpen attention, relieve anxiety, and improve learning, all without medication. It also helps with seizures, processing trauma, just a whole bunch of different things. Neurofeedback. The form of neurofeedback that we do is called LENS, low energy neurofeedback. And like I said, you can deep dive on my website and look up our YouTube videos, and it goes in super detail from what its experience is like all the way to the end of what it's just even people's Google reports of how much improvement that they've had, Google reviews. So that's all I'll say on that. So we use neurofeedback in intensives. So I already mentioned Dr. Bessel, psychiatrist, is one of the lead found researchers in trauma. This is what he had to say. In his research with his own patients, he found that there was a significant decrease in trauma symptoms after one course of neurofeedback. And also he found that it increased their mental clarity, their ability to regulate their emotions, their nervous system. And he also found that there was a 40% decrease in symptoms of trauma, PTSD, post-traumatic stress disorder, and just overall trauma symptoms, and a 60% increase of their executive functioning with traumatized children and adults after the neurofeedback. And he explained that neurofeedback, and here's a quote from him, has a marked effect on executive functioning. The capacity, which is the capacity to plan activities, to anticipate the consequence of someone's actions, to move easily between one task to another, and to feel control over one's emotions. And he said, to my knowledge, there is no other treatment that has achieved such a marked improvement in executive functioning, which predicts how well a person will function in their everyday life, in their relationship, their school performance, and at work. And a lot of times, I don't want to go off on a soapbox, it's a whole nother webinar, people get misdiagnosed with things and ADHD because of the executive functioning. And really, it's the root of their issues is the trauma. It's hard to focus. It's hard to concentrate. You're anxious with trauma, right? There's all those things that are similar or act in the same way as ADHD, but it's not. And so just as something else to consider. The other way that modality that we do in intensives that I really wanted to highlight was brain spotting. So I am 4 levels of brain spotting trained. I love it. I keep getting more training because it's powerful. I also see my own brain spotting therapist. Shout out to them if they ever see this, but continually working on whatever comes up for me and have already processed my traumas from childhood through brain spotting. So brain spotting is a form of therapy that aims to help clients process really difficult emotions or traumatic experiences. And what it does in brain spotting, it uses different eye positions to help identify what's called brain spots that are linked to a certain experiences, emotions, or a source of distress in an individual. And once it's identified the visual where we're going to look to process, then we use mindfulness techniques to help the client access the experience and process the thoughts and the feelings stored in brain spotting. So you can check out upcoming videos, but the whole idea is when clients are talking to me about their trauma experience or what they're coming in for, I can see where their eyes go. And then I can guide them and invite them to continue to look at that spot and see what comes up for them. And I see a lot of somatic body things that will come out of that: rapid eye blinking, twitching. Sounds like it could be scary, but it's the body processing, because we know that a lot of times a trauma gets stored, and right here we talk about that in that non-verbal part, that deeper part in your brain. And the only way to unlock that is through somatic modalities like brain spotting, like lens neurofeedback, like EMDR, like polyvagal, things like that. It's accessing that deeper level. And you can talk all you want and talk therapy and try to make meaning of the trauma, but it's not going to reach that deeper level. So if we look at the little image, the difference between brain spotting and talk therapy all processes on this top cerebral cortex, reasoning, right, and logic. And then trauma is stored, like I said, in the deeper midline brain or neocortex. Brain spotting goes through that layer into that neocortex, into that midbrain, and it heals the trauma throughout those layers of the brain, really releasing those experiences so that, my clients will tell me that, trauma trigger where I used to look at these certain things and I would feel anxious because it would remind me of what happened to me when I was a kid. Once they have done brain spotting and lens, now they don't feel that. Now they're like, oh, I can look at it. It's not a big deal anymore. It doesn't take away the memory, but it doesn't feel as real. That's what we're looking for. So think about a traditional weekly therapy cycle, right? You go in to see your therapist. You love your therapist. We're cool. We're awesome. We're connecting with you and we're helping you, right? So you do your 10-minute check-in. Let's check in. How has your week been? What happened to that thing last week? Tell me what happened with that. Were you able to do this, right? Okay, we're spending 10 minutes or so checking in, right? Then we're spending to the crisis of the week, 15 to 20 minutes. Now you're talking about, oh my gosh, let me tell you what happened this week. But maybe the goal was to treat that childhood trauma that happened when you were a kid. But we're going to, Victoria, I had a hard time dealing with this thing this week. But we know it's because of this, right? Back in the childhood trauma. We spend 15 or 20 minutes talking about that, problem solving. What did that feel like? Processing those emotions. Okay, now we're going to shift and we're going to do the trauma work. We're going to use the brain spotting or during the check-in, we did lens. And now we're going to process. We're going to talk. Okay, we got 10 minutes. We're going to utilize that 10 minutes to try to do some brain spotting and try to get a little bit of relief on that traumatic experience. And then after that, so we're about maybe 40 minutes in. maybe coming up to the 45, and now we're going to do our goodbye and scheduling. See you next time. So if you look at this cycle, the really deep work happened in 10 minutes. And all of those other things were important, checking in, helping you process what happened that week, and acknowledging your feelings and processing what you could do next time if that event comes up again, and learning a coping skill and learning how to deep breathe and practicing that. All of those things are important. When you're talking about healing from trauma, that 10 minutes is not enough. It does help, absolutely, but it's not enough. We need more time if you really want to feel better quickly. But if you like, I'm not saying that this is a replacement for weekly sessions, even though I've really healed from childhood trauma. I love seeing my therapist. Sometimes I see it weekly, sometimes one time a month, sometimes every other week, because it's just part of my well-being. I love it. And I can't imagine not doing it. But the most effective trauma support I've had is that deeper level of processing in a longer amount of saturated time. Some of my clients that I have done mini intensives, which is about 90 minutes to 3 hours, have report, I may only do them one time a month, see them one time a month, because of how much better they feel so much more quickly. I might see them, some of them choose to do a 3 hour, maybe one time a month, maybe over the next like 3 or 4 months. And that's it. That's all they needed. But more powerfully, how much more quicker to do several days, long days. So Tri-Synergy Counseling Intensive. So each day of an intensive period includes a variation of the following breakdown, right? So you've got the morning part, which is about 3 hours, and which it is like 2 60 to 90 minute sessions. First, you would have a lens neurofeedback session, and then you would do some brain spotting. And then that would include breaks that may be a variation depending on what you're feeling and experiencing, some coping skills, relaxation techniques, time to process what the experience was like, talk about what were you feeling, what came up for you, as much as you want to share or not. And then we'd have our 1 hour lunch break to reset, nurture our bodies. And then we'd have the part 2, another 3 hours, which is, again, repeat, rinse and reuse cycle, right? Redo again. We're going to do the same process again. And then after that, we're going to spend time processing at the end what the whole day was like, right? And so if you're someone that is looking for 3 days worth, we would continue to do that. That cycle would repeat itself. And what would happen is we would include some of those other modalities, like sand tray therapy, where we might do brain spotting in sand tray. And I didn't talk a lot about sand tray, but it's basically using figures and sand to be able to process right and left brain hemispheres, to process nonverbal response and more physical. It processes trauma in a different way. And I pair that with the brain spotting. Super powerful. And then what we have to offer, not everybody has the time, or maybe, because life, we get busy, right? Or maybe we don't have the resources, because as you saw, the number, the cost can be expensive. And I understand that sometimes we might not have that resource up front, financial. So you can book a mini intensive of 3 hours. I talked about that, right? Or you could just do one day, right? And so for as far as scheduling with us, what that would look like is that you could schedule one day, and it would be during the weekday from traditional work day from Monday to Friday, any of those days. And then those rates would be more of a discounted rate, I call that. If you want intentionally, you want a 3-day weekend, Friday, Saturday, Sunday, then those weekends would be outside of normal working hours and would have a little bit higher fee, higher rate. And then all of our intensives, counseling intensives, include personalized workbook that's tailored for you with skills on how to take care of yourself, recommendations, things, journaling prompts to kind of help you before, during, and even afterwards. to continue kind of like that work or that adjustment period after, now that you're feeling better. And sometimes, if you're one of those individuals just doing a day, purchasing a day, you might find that you need some spot check-in later, right? And then we do offer virtual intensives for those who are residing here in the state of Tennessee. And now, virtually, you would not get a lens neurofeedback application. You would have to come. There's a hybrid model where you would come to our office to get the lens neurofeedback. And some people like to have an intensive, one-day intensive, and then continue to use the lens neurofeedback over maybe 6 or 10 weekly, or accelerated 2 or 3 times a week in a package, right? So that's an option too. But clients must come to the Brentwood, Tennessee office to get the lens. So those are the variations of what we can do. Something I didn't list on here is that we do offer group intensive sessions. And so that can be in a more affordable way to process trauma. Oftentimes, what I like to do is maybe like, especially virtually, this is really useful, 3 to 4, I might have, 4 to 6 people virtually. And we're doing these modalities together in a little mini group over a virtual platform. And that really can, if you're willing to heal together in a community, or a small community, that can really help with the cost of the sessions or the intensives, because that allows, for me, our Tri-Synergy Counseling to offer a lower rate since the fee is being shared with other people. So that's a really good way to get it at a more affordable rate. And it's a really awesome way to heal with community, because we'll be processing with the group and hearing and healing from each other's stories and being encouraged and witnessing each other's healing. And that's a really powerful way to accelerate as well. Well, I'm going to leave you with, you can look at this for a few minutes, what clients are saying. This is reviews about lens neurofeedback. As a counselor, it is not ethical for me to ask my clients to write a review for me for therapy. And I take that very seriously. I would never want to put a client in a position to expose themselves from the therapy perspective. I really want to honor their privacy. And so I never ask a client to write a review for me on counseling. But I definitely get lots of word of mouth on how powerful our counseling is here at Tri-Synergy Counseling. So if you have any questions, please feel free to email us. You can email us at admin@tri-synergycounselingtn.com. You can visit our website and fill out our interest form or query form. And I please ask you to sign up to our newsletter. We send it out. It's a month-ish newsletter. Sometimes it's every 6 weeks. But it's just providing you with our services, upcoming intensives, so you get to be the first to know about the next available group intensive, our webinars, our learning events that are free to the community, and tips for mental health and wellness. So with that being said, thank you for taking time out of your day or your evening to watch and learn about how powerful intensives and can be for you or your loved one, or just that healing, faster healing acceleration. All right, I will see you guys next time.